Welcome to the Cystic Fibrosis Foundation's CF Education Day webcast, Living with Cystic Fibrosis-Related Diabetes, CFRD. I'm Melissa Chen, Clinical Program Specialist at the CF Foundation. This webcast is hosted by the Foundation and supported through an unrestricted educational grant from Genentech. To watch additional webcasts about CF-related diabetes, watch an archive webcast on the CF Foundation's website. Joining me today is Tim Tolis. He is an adult with CFRD as well as CF. Welcome, Tim.
Thanks, Melissa. Glad to be here.
So I want to begin by you telling us a little bit about yourself. How old are you now?
I'm 53 years old, and I work here. I was born and raised here in the Twin Cities. I graduated from college in 1981, and I've been selling real estate for a local company here in town for the last 30 years.
And at what age were you diagnosed with CFRD?
I had surgery when I was about 30 years old, and the doctors kind of made the correlation there with, and they wanted me to get on insulin at that time, but I actually didn't get on insulin until about 6 or 7 years later.
So at what age were you diagnosed?
I was diagnosed at, I would say 30, got on insulin maybe 35 years old.
So you've been managing CFRD for about 16 years now,
Yeah, 16 or 18, yeah, right.
And how did you feel when you first got diagnosed?
I was a bit angry, when I was first diagnosed, a bit angry, and like I say, a little bummed out that I have to manage two major diseases. So I was in a little bit of a denial there where it took me a little while to kind of come to terms with it and actually grasp dealing with both.
So where did you find the support to deal with these feelings?
I'm very lucky, very blessed to have a supportive family. The CF team is excellent, and then I'm blessed to have a great wife who also helps me a lot.
That's wonderful.
Yeah.
So describe for me what a typical day is like managing CFRD.
A typical day would be I'd get up at about 6:30 to do my BD or bronchial drainage treatment. That's the pummeling or the vest where you clear mucus from your lungs. But I'll check that at about 6:30, do my treatment. It takes about an hour. Then I'll check it after that before I eat breakfast. Then I'll check it before lunch and about 2 hours after lunch, and the same thing for dinner. And then when I go to bed.
And how do you manage that when you go to work?
If I'm out and about with people showing homes, I'll generally check it halfway through, and I can, even if I don't have indications that I might be getting low blood sugar, I just check it to be safe when I'm with people. I don't want to have a low blood sugar when I'm out showing people homes.
And how do you maintain those blood sugar levels and also meet the calorie needs for CF?
My endocrinologist, Dr. Moran, she pretty much says I can eat whatever I want and just make sure I cover it with insulin. So it's a kind of a catch-22. You want to make sure you eat enough carbs and calories to maintain a good weight for the cystic fibrosis, but you do have to watch the sugar intake for the diabetes.
Now, I understand that you use an insulin pump, but then used to use injections. Can you tell me, do you have a preference and what the difference is between the two?
Sure. The pump, the insulin stick is very convenient. You dial in the number of units that you need after you eat, and then you would stick yourself in the thigh or in the stomach or whatever. But I did that for a number of years, but then I switched over to the pump about 7 years ago, and it's much more convenient. Gives you a better and more steady flow of insulin to your body. So, and then when you use the insulin stick, that's where it becomes a little bit troublesome as to where you give it. If you're out and about or in a restaurant or whatever, you have to usually give it in your thigh or your stomach, and whereas the pump just injects throughout the day. It's a site that you don't have to worry about it.
And how do you know when your blood sugars are low, and what do you do when that happens?
For me, I have 3 indicators. One is my vision will kind of go tunnel vision, so I could kind of tell if I get up in the middle of the night sometimes, I'll have low blood sugar, and that's the first sign. And the second, it would be I'll break out into a full sweat. I can tell then that my sugar's going down pretty rapidly. And during the day, or if I'm with somebody, if somebody's talking to me, sometimes I won't really absorb what they're saying. I'll see them and listen to them, but I kind of get a little spacey. It's going to be a little bit spacey, so you have to take some sugar. Then I'll check my insulin right away and take sugar accordingly.
So
Excuse me.
how do you compare the time it takes to do your airway clearance versus checking your blood sugar and giving insulin?
Actual time-wise, Physically, it's a lot longer to do the airway clearance because it's 3 hours a day. And before each treatment, you have to do about a 15, 20-minute aerosol. So that's about 4 hours a day to do that. Whereas checking your blood sugar takes you less than a minute. And then if you're going low, you have to have stuff with you at all times or whatever. But if you're high, then you just take the pump out, put in the numbers, and then it'll give you the amount of insulin that you need.
So really managing CFRD doesn't really take that much more time than taking your airway clearance. It's just something additional that you add into your life.
Right. It's actually less time to manage, but it is on your mind all the time for me.
So how do you manage a lung infection while also having CFRD?
Sometimes when you have high blood sugar, there's an indication that you do have an infection, so you probably should call your doctor, and they would test and see if you do have an infection. You might have to get on oral antibiotic or possibly IV drugs. But when you do have an infection, sugars tend to run higher, so you have to check it more frequently.
And what are the benefits for using insulin? Have you found any?
For me, it was huge in the fact that I never could ever gain weight. I always was 150 pounds at my max weight. Once I got on insulin, I gained approximately 30 pounds, and I've kind of maintained that weight within 3-4 pounds for the last at least 5 to 7 years.
Oh, wow.
So it was a huge benefit.
Have you found any challenges after being diagnosed?
Yes, for me, it's a big challenge. I have to make sure that I always have a cooler with me or food. So I always carry a cooler with a couple pops, a couple bottles of juice, a sandwich, just in case you need it, because I am on the go quite a bit, and that's kind of a drag to always have to have that with you, but it's a must. So.
And do you find that you have to go to the bathroom to check your blood sugar, or are you okay with it in public?
When I first was diagnosed, I was way more self-conscious of it. I was younger, I guess more immature, but now it's not a problem checking it anywhere. I could check it in a restaurant, and I was at first too. I was also not embarrassed, but kind of hid the fact that I had diabetes and would not do it in front of other people. Now I just tell people right up front I have diabetes. Everybody knows somebody that has diabetes, so it's not a problem at all.
And how often do you go to clinic, whether it's for CF or for CFRD?
For CF, I go to clinic every 3 months, assuming things are going well. If I have an infection or if I need tighter watch, they'll have me come every 2 months, sometimes every month. But on a good year, I'll go every 4 times a year for the cystic fibrosis. Diabetes, I see the endocrinologist once a year, sometimes twice, and I'm always able to call them if I have questions.
So that's typical about how often a normal CF patient would visit there.
I think so, yeah.
And what is the most important thing that you would tell somebody who is newly diagnosed with CFRD?
The most important thing would be to listen to your doctor. Don't fight it. Because I did fight it. I thought I could control it with exercise, which I did do for 3-4 years, and kept it in check. But then again, the older you get, the more plugged up you get with your insulin. I mean, your mucus blocks off your pancreas more. But again, just listen to your doctors. Don't fight it, and you're going to have good results.
Thank you, Tim, for answering those questions.
You're welcome. I'm glad to be here.
For more resources, go to the Cystic Fibrosis Foundation's website. Under Living with Cystic Fibrosis, click on Staying Healthy. Then go to CF-related diabetes to download the Managing CFRD manual. To read the CFRD guidelines, go to Treatments, CF Care Guidelines, and then go to the section Nutrition GI. Here you will find topics about management, screening, and nutrition. This concludes the Cystic Fibrosis Foundation CF Education Day webcast, Living with CFRD. I want to thank you for watching, Tim for answering questions about daily management of CFRD, Rick Vasta and the technical crew, Leslie Hazel, Genentech, and the CF Foundation for making this webcast possible. Thank you.